For the last 6 years, Dr. Angella Atukunda has been serving as a physician at Mulago National Specialized Hospital. Like any other medical practitioner, the word pandemic sends chills down her spine. So when the first COVID-19 case was declared in Uganda, Dr. Atukunda was scared at first.
It is something that comes with, should I say, some sort of fear and preparedness of the mind of this is a pandemic and we have to face it.
But the news that her colleagues on the front line were falling victim to the disease gave her the courage she needed to join Mulago's COVID-19 unit.
We had a spike and the patients were so many. I had been working in a different unit, but after that, I said, let me join the corona treatment unit. I did not inform my family that I was going to join the front line. Actually, they got to know when I featured on NTV showing people around the corona treatment unit.
As such, Dr. Atukunda had to endure the numerous challenges that came with being a frontline worker during the pandemic.
You are at the front line, your risk of exposure to the virus is so high. But at the same time, you're taking care of people's lives. There are times I had to move home at 3 a.m. Yes, I would be driving, but scared, scared of what if I get robbers? I'm only alone in my car, I'm a female,
Amidst these challenges, Dr. Atukunda found joy in discharging patients who were declared COVID-19 free.
So it felt really good when I saw those patients who myself, I thought they would not get well. But they would get well. Yeah, some of them lost the battle, but maybe 98% of them healed and went back home. So it would be refreshing.
With the cases of COVID-19 now going down, Dr. Atukunda and the rest of her colleagues are also getting a much-needed respite. However, she is worried that there are still few female medical practitioners in the country.
Because right from the beginning, when you join medical school, you'll find 35% are women, and the biggest percentage are men, are boys. Okay, at that time you are boy, girl. In a way, you're usually the minority, The women are the minority in the health profession. But at the same time, the opportunities, I think the health profession has been fair in a way that the opportunities are shared equally, even when the women are fewer.
Dr. Atukunda has told us what Women's Day means to her.
I feel is worth it because the women are celebrated and remembered on that day, You can do this thing and no one really cares or no one really ever gets to know about it. But on Women's Day, it's remembered. And then it also reminds the world that the opportunities in this world should be shared equitably, between women and men.
For a long time, government has been encouraging the uptake of science courses as well as offering special consideration to female learners to enable them pursue their studies to the highest levels. If government can address the challenges faced by female learners, then maybe the country will get to celebrate more female doctors like Dr. Angella Atukunda.
Infected and then
Joyce Nakato, NTV News.